Welcome back. Now, the City of Tshwane is appealing to residents to follow COVID-19 regulations as it's seeing an increase in new infections. Now, it says this might be linked to illegal festive season gatherings. The city's health MMC, City of Tshwane, says the situation hasn't reached crisis level yet, but he joins me now to discuss this even further. Mr. Tshwane, good morning and thank you for your time. Now, you're raising this appeal, or rather, sending this appeal to your residents, which is quite important, but is it because you have been seeing some non-compliance within the City of Tshwane?
Yes, of course there are non-compliance. We notice it when we go to shopping centres, and a lot of people report that to me. But there's also a lot of compliance. I think after all, handling this is not a matter of the authorities to be able to control it properly. I think we need a lot of self-discipline because it's for the sake of the survival of each and every person in Tshwane. Yes, there is a lot of transgression of the laws, and the Tshwane Metro Police is actively involved, especially during the weekend. They will do so again like they do over the festive season, is to stop illegal gatherings, because super spreading is one of the major causes of the virus continuing and actually spiking.
Yeah, this is an important message, right, especially because holiday makers are making their way back into Gauteng, the City of Tshwane being one of the cities with which they work and reside there. I mean, how is the city faring in as far as hospital capacity, healthcare workers there, with some of the patients that are testing positive and coming into the hospitals?
Yes, we're even assisting the people testing, the laboratories, to make it possible for them to do testing, because there's a lot of queues in different areas of the city of people who are really concerned and who turn up for testing. But the situation in the hospitals, I receive conflicting details, whether it is already full or not. But I believe they are still willing to take people there. Some need to be hospitalized. But it's not only the hospitals that are assisting. We must be aware of the clinics that are there, especially for screening and testing. The City of Tshwane itself has got 24 clinics where we just do that. So people can come, and it's often a problem of payment. It's free. It's a government service. So if you come to the clinics, one can be tested.
Right. There are many calls and concerns around the state of preparedness. In as far as Gauteng is concerned, as one of the hotspot provinces for this surge and increased number of COVID positive cases, how is the City of Tshwane preparing for this surge in numbers?
No, we've started preparing some time ago because we were aware of it since the beginning of December. Just to give you an idea how serious it is in the City of Tshwane, the spike that we've experienced in the first week or the second week of December, we had an average of 263 new cases with an average of 4 people dying per day. Now, in the first week of January, it has escalated to 1,286 cases per day on average, and 29 deaths on average, so 7 times more. So our preparation is that all our people are here. There's nobody on leave anymore from the clinics. They are in full force, but they are exhausted. The people have been working now for months, and especially over December. But we do our utmost. We also do screening at the hotspots. We visit the different hotspots with a mobile clinic team. So we go there and do screening. So we make it possible for citizens out there, especially at the hotspot areas, to come and do the testing. And that, of course, is like any other clinic, free of charge.
All right. We'll leave it at that. But thank you so much for this update, Mr. City of Tshwane, the MMC of Health at the City of Tshwane.